Hello, I'm John Pope. I'm a member of the team here at TechTank Mobile App. Um, Thank you for giving me the chance to give you this quick presentation, let you see what we've been working on and what it can do for you. My background, to be fair, I am not a professional presenter. I have a background in emergency management in both pre-hospital and hospital bedside care, so hopefully I can at least explain it better. TechTank was originally designed to be real-time clinical data gathering for us to be able to mitigate and respond to certain health events or even prevention efforts. When COVID came along, we actually were able to morph it because we were halfway into building it already and make it to where we could actually apply it to the COVID situation at hand. As a side note, we operate under the Take the Heart initiative, and we operate as nonprofit under a 501c3. Now, in this presentation, I will quickly and hopefully usefully show you how this works and what you can get out of it, both for the world itself and your facility or organization. Other than that, a basic how-to website, which is the address below, will tell you how to use the app and any other user who picks it up. But we will go over this. What you see here is a screenshot from my phone, actually. You can download the app. It's TechTank, no spaces, right now on any iPhone or iPad or iOS device. And it should be available on Android here any day. It may even be available now by the time you see this presentation. You look it up, download it. This is what it looks like. There's the icon, and then you can get into the screenings. So, to walk you quickly into how we get into the screening and how it benefits. The first slide you see on the left here is the very first thing that comes up. You enter the code. We have several screenings in here. We have a consumer screening, which is just a basic code. And then we have a pro screening, which is your more detailed screen, but also has a few more things that you can use as a company or organization. So you enter the code for the pro version, which is probably what you'd be interested in. It would be entered here. And then the next slide you see is what you get into. Now, something we always have to explain and want to make sure that you're clear of, the patient ID code is not their medical record number or anything like that. It can be whatever you make it specific to your facility. I made up something here just to show you how it could work. The next two that you see to the right there, I made Make Believe Medical Center, and the first one I just did initials and their triage number. The other one I just did Make Believe Medical and numbered them patient number one. You can do anything you want to there to identify your own patients. Nobody else would be able to. Or you could just put the name of a facility if you were just collectively gathering one group. That would be up to you and how you use it. Zip code is required on all surveys. That way we can at least locate the zip code. And then we can get into how they geolocate a little bit here in a minute. NPI number is optional. That was a request and suggestion by some colleagues. Once you get past that screen and you go next, the blue screen you see here on the left is a picture of one of the questions in the screen. None of these screens are long. In fact, the pro version is only 9 screens. If you've never taken it before, you read it all the way through, and it takes 30 seconds to take the whole screen. Yes, no questions. You click, it automatically swipes. I think the only one you have to fill out is your age. Once you finish, you hit submit, and it will record it and send it to the data repository. You can hit start over if you miss something, or you can go back to home if you want to do a different screen. Once you do submit, it will give you the option to take another survey, or excuse me, another screening, but you can choose any of the screenings out there, or you can redo this, which comes in handy if you have multiple people you're trying to help, family members you're trying to help, if you're a provider and you're doing it for several patients, so on and so forth. The app and the screening are free to the user. They're free to download, and there is no cost incurred at that point. That way, we can get it out to everybody, everywhere, anytime, anywhere in the world, and they can use it. What's so great? Their screens are already all over the place. They're on the TV, they're on the internet. So, how does this any different? Well, if a home user, a consumer, takes the screen at home, they enter their zip code, so that gives us at least where their home location is. But wherever they're standing at that time, the app will geolocate where they are, thanks to GPS and the way things work. The home user gets the benefit of the screen, which they would anyway, but we gather more intel and information of where they are, not just to their person. We're not trying to find that one person, but the area. That'll help us. If we gather enough information, we can find our hotspots. We can find when they happen. We can find areas where the symptoms were the same or if they were different and when they started developing. And if they're all alone in one area or if they're scattered all over the place. So that alone just gives us something to work with and share data as far as mitigating the circumstances of the situation. How does the pro version make a difference? The pro version, you're using it specifically. So if you're a facility, an organization, a company, you would take the pro version. Like we said earlier, you can take that patient ID and make it specific to yourself however you want. And then when we pull the data out for your facility itself or to collectively, you can actually see specifically what your data looks like, what came in your place, and can be abstracted that way specifically. If a person knows their own ID, say you put in patient TR01 and they come back for a second test, or they got a vaccine and they come back, or anything like that that your facility wanted to track, they can put in TR01 again and you'll be able to follow and see their testing schedules. Few examples of how this could work. If a church is operating online like we are now with social distancing and into the future, they could tell all their members to take the screen. If all their members took the screen at home and the church just used their name, they would be able to see what members are sick, where they're located at, everything. That would give them so much information. They could even see if they should even think about opening their doors again yet. If a hospital told all their providers to fill it out over the patients they see, they could see where they come from. They could see the types of symptoms and everything collectively. And there's numerous reports you could pull from this, as well as the hotspots. Imagine if an ambulance service, a fire department, or police filled them out when they picked up patients or dealt with the public. Because the app geolocates, you would see everywhere it happened almost instantaneously. One of the greatest things about this is it's real time. If a prison were to screen all their inmates, or a nursing home screened its residents, the possibilities are endless. So, just to kind of give you a visual, if everybody takes the screen, what you see here is the consumer version. Nobody sees this except the data repository. This means we can pull this out when it's time to share it with CDC or emergency management or just facility specific, depending on where you're at. We can actually take, you see all the questions, and we can extrapolate what you need. This is an example of what the COVID-19 Pro screening can do. And you see here we blacked it out, but there's personal patient IDs that you could put in and zip codes and addresses. That's just to protect the ones that have already done it. But we can gather all this. Almost the minute they take it and submit it, it shows up in this data repository. The thing is, if you do a patient ID that's specific to you, it's not patient information that can't be shared because it doesn't identify the person. That way we can take it all collectively, we can provide facility data, but yet we can provide worldwide data to help with mitigation and response planning. Hotspot capability. Because it geolocates, because we gather zip codes, and because we can get anybody to take it anywhere, we can develop the hotspots. We can learn where we need to put things, where we need to focus resources. The visual you see here is, apologize, it's just an example. The left one is a world map of cholera outbreak, and the right is a United States map of HIV. Um, the thing is this is what we could do, but we could also do this almost on the spot instantaneously. So what can it do? What can it give your facility the capability to do? You can source track by zip code, like we mentioned. Patient can be identified to the point you desire as far as how you put them in by ID. We can geolocate wherever it's taken, anytime, anywhere. Another thought we even mentioned was I do work at a healthcare facility. We're having to take temperatures before we walk in the door. What if you had your facility employees do their own screening before they came? Waves and surges. You could see when you got hit the hardest, when you had lulls. You could see why and where they came from because the patients would take the screen and you would be able to see where they all came from, where the hot spots were. A big advantage we've noticed is if you had a smaller facility that doesn't have the metric capabilities that some of the larger ones do, this would be a great way for them to obtain some of the information they need. And furthermore, all of the data comes out, like we showed a minute ago, in Excel format. It's easily extractable. It has merging capabilities and it's presentable. You can pull graphs, charts, whatever you need to out of it. Example, actually, this was a facility that I've worked with, and we did pull all the numbers off so it wouldn't be very obvious. But this is just a pie graph of one question: have you been tested? And so, just this is a simple Excel pull, just something you can present and show. The way this can impact everywhere, not just your facility. This is us helping each other. At local, state, national, and even global, we can change the world and save lives. We have a whole data warehouse that'll gather to share. We can use it with CDC, DPH, WHO, universities, research, planning, containment, mitigation, and because it's so fast, because we can gather it in real time, response and even recovery are a possibility. Not just for COVID, but even the next incident. But right now, this one's real. You can pull real time immediate data. It's shareable without crossing ethics and guidelines and personal information. So help us help others help you. We got an app for it. We just need people to use it. Thank you for giving us a chance to show you, all of us here at TechTank.